Now in the third section, we will talk about the assessment during labor. In this section, we will talk about the assessment of fluid and nutrition during the labor, and duration and onset of labor. How long is the duration of labor and the onset of labor also. And then fetal assessment in labor is also very important, how the fetus is behaving during the process of the labor, and continuous monitoring and assessment of the fetus during the process of the labor is very important. If the fetus shows any assessment of fetal well-being is important. If there is not the assessment, or if the fetus is not normally behaving, if there is too much deceleration or acceleration, it means we should intervene and in the process of the labor. So let's begin. Fluid and nutrition during the labor. If operative delivery, we should have no intake of food because we need to give anesthesia. So if operation is required, no food intake. Vaginal delivery can take fluid and light nutrition is fine. Imminent delivery, IV fluid replacement therapy. So if the immediate intervention or imminent delivery is required, then IV fluid replacement is given. Dehydration can cause acidosis and ketosis. Signs of dehydration is tachycardia, the heartbeat is very fast. Tachy is fast, cardia is hard, so rapid pulse is one sign of dehydration. Mild pyrexia, mild fever is present also, and there is loss of tissue turgor. The tissue turgor is lost, the tissue becomes less elastic, and loss of turgor of the tissue is present. So these are the signs of dehydration, and it can also cause acidosis and ketosis. Administration of normal saline Hartmann solution. Posture in labor. So we should have a comfortable posture for the pregnant women, and depending on what posture is more comfortable or more helpful in the process of the labor. So posture is can be some remain ambulant or sit in chair during first stage. So if the first stage is prolonged and it's taking long, too much lying down, sometimes it's not preferred. So mother can sit or they can walk around in the first stage of the labor. Preference to lie down as labor advances. Or some also flotation is also another posture in labor. Duration of labor. No ideal length of the labor. So there is no hard rule that the labor should be 2 hours, 3 hours, 4 hours. Depends. No ideal length of the labor is present. But morbidity increases if it's too fast or too slow. So there is no specific time limit for the duration or how long should be labor, but if it's too fast, very rapid, it's dangerous, and if it's too slow, again, it's dangerous. So it should be in the middle, not too fast, not too slow. Fetal assessment in labor. Fetal assessment options in labor, the few things that should be constantly monitored or assessed is inspection of amniotic fluid, intermittent auscultation of fetal heart, continuous external electronic fetal monitoring, and continuous internal electronic fetal monitoring. Fetal scalp blood sampling. So all these are very, very important factors in the assessment of the fetus in the process of the labor. Amniotic fluid assessment, heart rate assessment, internal electronic monitoring, external electronic monitoring that gives the good idea of the fetal well-being and fetal assessment. So all these should be followed. Again, indications for the use of continuous electronic fetal monitoring. What are some conditions in which continuous electronic monitoring should be done? The maternal indications are any history of previous C-section, pre-eclampsia, post-term pregnancy, if it's after 40 weeks, post-term pregnancy, prolonged rupture of the membranes. If the membranes are ruptured for a long time, there are complications like infections can occur, and there should be the internal monitoring of the fetal well-being. Then induced labor, diabetes, antepartum hemorrhage, and other maternal medical diseases. So these are some indications in which continuous electronic fetal monitoring should be performed. Then in the fetus, fetal growth restriction, prematurity, oligohydramnias. If amniotic fluid is less, we should continuously monitor the fetal well-being. Abnormal Doppler artery velocimetry. If there are multiple pregnancies, meconium stained liquor, and breech presentation. So all these are the indications for continuous monitoring during the labor. That was all about section 3. Thank you for watching sqadia.com.